I am Dr. Joseph Yadegar. I am a board-certified surgeon and have been practiced in Beverly Hills and for the past 25 years. Our philosophy is that each patient is an individual with very specific needs, and in our consultation we try to address the wants and the wishes of the patients, and obviously we do make our own recommendation depending on the impression and the look that the patient wants to have. We believe that the consultation is a very important part of being able to convey to the surgeon what the patient actually wants, how they want to look, and what it is that they expect from the surgery. At times, the patient's expectations are beyond the ability of the surgeon to be able to produce, and that should become very clear. And if the expectations of the patient and what the surgeon can produce is very similar, then one can expect excellent results. We have created a facility, Rexford Operating Rooms, which is a Medicare certified facility, and all the physicians, surgeons, anesthesiologists are board certified by their specialty board, and we have experienced nurses and experienced surgical technicians who help us with the surgery. Some of the important procedures that we perform, some of the commonest, include breast augmentation, and this can be done with both silicone as well as saline. Although the saline is the norm and has been for some years, but silicone is gaining popularity, and the feel of the breast tends to be better with the silicone, even though it is more expensive. In addition, many patients will require a minor or a major breast lift with or without their augmentation. And this is another area where we can help the patients decide what look they want and what would be the appropriate procedure. The other common procedure that we performed is the famous tummy tuck, which is the part of the body that is difficult to hide. Many women who have a relatively normal size upper body and relatively normal size lower body have abdominal girth that they cannot control or hide. Tummy tuck, with or without liposuction, usually helps in bringing the abdomen into line with the rest of the body. The tummy tuck can vary in its extent. It can include just the front of the abdomen or the sides, or in the cases where patients have lost large amounts of weight, like after gastric bypass surgery, they can have a circumferential body lift, which is an extensive tummy tuck with butt lift and, to a certain extent, a thigh lift. We also performed facial surgery to improve the looks of the aging eyes, which is usually the first procedure people, men and women, prefer to perform because that's where the age is more pronounced. Also the facelift and liposuction of the neck and neck lift as part of our procedures. It is important to note that other than Botox, which definitely helps with relieving the wrinkles around the eyes and the forehead and between the eyes it has no substitute. But as far as the fillers are concerned, the Restylane and the collagen-based fillers that have been used for years have a short lifespan, and we prefer to use the fat transplant techniques that are being more widely used and developed. And in this procedure, I stress the fat transplant as opposed to fat injection, because the technique that we use, the way we purify the fat and inject it, we hope that this fat develops a blood supply and becomes alive, and it not only acts as a filler, but also improves the quality of the skin, because there are stem cells that create new collagen over time. We usually estimate that the improvement following fat transplant to be 2 years, and the effects may last up to 10 years, which is far superior to many other procedures, and in the long run, much cheaper than the Restylane and other collagen fillers. There is no end to what people desire and what we can perform for them. With time, new procedures are being developed, and at present we have a procedure we call the genital cosmetics, which essentially is the beauty of the perineum, which includes the vagina, includes the skin around it, as well as the anus, and this involves what you might call removing all the blemishes and excess skin around the anus to make it look pleasing, to remove blemishes of the skin around the perineum, and also with the vagina to trim excess and loose skin, as well as allowing the vagina to become tighter, which some people refer to as rejuvenation. And in addition, we can inject the area of the G-spot for sexual enhancement. All of these are specific to individual patients, and collectively can produce very pleasing results. Many patients have been surprised that such procedure for beautifying the genitalia area exists, and the demand for it seems to be increasing, since there are very few women who have gone through childbirth who have not developed excess skin or hemorrhoidal tissue that takes away from the beauty of the perineum. So our consultations with our patients is rather thorough, and most of it is for us to understand what it is that they want and what we can produce, and try to match their expectations and our ability to produce results. And this, we believe, is the beginning of a relationship that can grow over time, as very few people undergo just one procedure. They usually down the line, maybe a few years down the line, would like supplemental procedures, and hopefully we'll be around here to provide it for them after we've developed our rapport and relationship.